So, um, today I wanted to talk a little bit about how to deal with a difficult patient. And mainly I'm talking to myself because the last couple of days have been difficult, um, and trying to find some ways to kind of ease that anxiety and that level of difficulty. One thing is to not get defensive. Oftentimes we might feel like all of the anger or aggression coming from a client is directed to us, but it's best to try to take self out of the equation, and to not take it personal. Another thing is to watch the body language. Um, don't approach the patient in a way that might come off um, as being aggressive. And one way to do that is to sit down next to the patient if that's an option. But you kind of have to err on the side of judgment, because if they're behaving aggressive themselves, then that might not be the best tactic. Let them tell you about all of their concerns, um, and just listen without saying anything until they've kind of vented. So that also might help to de-escalate their emotions. Acknowledge their situation. You don't have to agree with it to acknowledge it. You can say yes, you understand, or something that kind of lets them know that you're empathetic. Again, you don't have to agree with it, because different people have their own perspectives, and it may not even be something that's logical that they're upset about, but at least you can just basically let them know that you're there. Be safe, as in setting boundaries. If somebody really is being violent and aggressive, you need to put you and all staff members' safety first. You don't want to put yourself in a situation where you're exposed to that and you yourself could be hurt or injured. Look for the underlying motive. Try to get to the root of where this is coming from. Learn prioritization strategies. So just because the client is angry, that doesn't mean they have to come first. If somebody else has more severe issues, they should be seen more immediately, no matter how flustered a client is. So you have to still know how to prioritize. Just like, if you're ordering something at a fast food place, or whatever the case might be, just because somebody is acting in a certain way, out of character and causing a scene, that doesn't mean they're going to get their order before everybody else. In some cases it might, but it's not supposed to. You still have to see who has the most pressing issues and address those immediately. Next, show compassion. This kind of piggybacks on what I mentioned before, but you kind of have to learn how to suppress your own irritation or aggravation that you're feeling towards that client, because they may be saying things that are kind of rude, or you don't like their tone or something. But you still have to be compassionate to the fact that they are not their best selves right now, and they are still your patient. Another thing would be to stay calm, and have my notes right here, so that's why I keep referring back to them. Another thing would be to stay calm. For me, I think this is really crucial, because that's probably one of my weaknesses. I will get a little bit too emotionally involved and not keep on that poker face that I think that you kind of have to be able to do if somebody really is offending you or upsetting you or something like that. But the goal is to remain calm. And in order to do that, if stepping outside for a minute and taking some deep breaths will help you gain back your composure, then that would be better than to get into an altercation or anything like that with a patient, because you never want to do anything like that. So just step out for a minute, maybe even if you really, really have to, let somebody know you need a few minutes. Again, that would be a better situation and a better way to handle that than to just stay in the room and get more and more and more flustered yourself when interacting with that patient. Another thing you can do is trying to connect with the patient. And again, this depends on the patient. This is not a fix-all scenario. But if you gain that rapport initially, that will help versus they've never met you before, they're already irritated, and you have nothing to say to them. So gaining that rapport, having an initial friendly conversation, letting them know that they can basically lean on you will help to de-escalate any irritations that they might have as well. But lastly, I think also it's important to realize what is just the patient being upset based off their circumstance and what is actual abuse of you and your fellow staff by the patient, under which circumstances that should never be tolerated. There are levels to that, and you have to realize what that level looks like. What is the cutoff mark for that when it becomes abuse? Yes, patients can be agitated and things of that nature. That's to be expected. But flat out name calling or inappropriate conduct, throwing stuff, trying to hit you and stuff, things of that nature should never be tolerated. So that's what I have right now for this list. Just because I did kind of struggle with that this week, I wanted to kind of retrain my brain about what needs to be done and how to handle that kind of situation, because not every patient's going to be a walk in the park or all sunshine and roses. Thank you so much for watching.